Hello, this is Dr. Dorothy Merritt, and this short but very dramatic slideshow will be on EDTA treatment of peripheral vascular disease. As you may recall from the previous slide set on the history of EDTA, it was developed in the 1930s to replace citric acid so that it would bind to calcium during clothes dyeing. Due to the First World War, they had problems getting citric acid from England, so they developed EDTA, which also binds calcium. Now, people think that there's just two types of EDTA, sodium and calcium EDTA, and there's all this. Those are just the two that are approved in humans. There's many different types of EDTA bound to different things to work at different pHs and such. It's in your cereal, your lab anticoagulant tubes, your makeup, and just about every part of life because it is an antioxidant. From the 1960s as well as the 1990s showed that EDTA worked well in peripheral vascular disease, particularly in diabetics. In one study from Denmark, 27 people scheduled for an amputation due to severe peripheral vascular disease were treated while they were on the waiting list, and only 3 needed surgery after EDTA treatment. As mentioned earlier, the first double-blinded randomized trial to look at EDTA was called TACT, and it was published in 2013, and it showed incredible improvements over placebo based on treatment with EDTA, and particularly in patients with diabetes. So these are the 4 components of the TACT trial. The people with the highest events were the placebo infusions with placebo vitamins. And these just fall right down where you would expect. The next group was the vitamins, the next group was the EDTA, and then the absolute best group was the EDTA with high-dose vitamins. So if you take the EDTA chelation with high-dose vitamins versus placebo, or the purple group versus the green group, there was a 26% improvement. This is a subset of the TACT trial in patients that had diabetes, coronary artery disease, and also peripheral vascular disease. In the treated group, there was 58% reduction of endpoints, meaning revascularization, death, stroke, or need for bypass. In order to prepare to get funding for a TACT-3 trial, which would look at diabetics with critical limb ischemia, this study was done. As you can see, this is a pre-treatment ischemic area of gangrene, dry gangrene, and this is after chelation therapy. This is the pre-treatment. This is the healed foot after chelation therapy, and same here and here. These patients also had pre and post lead and cadmium show up in 700 to 4,000 times the amount expected after treatment. It's a case report of a patient in her 80s with diabetes, previous vascular disease, previous stroke, and coming in with critical limb ischemia and was scheduled for amputation. As you can see at the beginning, foot is blue. After infusion 5, it's pinking up. Infusion 15, infusion 22, and after 41, this is the foot, which is now painless, and the patient can walk, and they still have a leg. This is the original vasculature showing no or severe disease down here in the foot, and anyway, there's just no good circulation. However, this was the Doppler prior, and this is the Doppler showing way increased blood flow after treatment. So here again, we know that patients that have this condition are very high in lead and cadmium, and that EDTA binds those things. And it appears in studies as far back as 1960, 1990, and now today with the TAC trial people, that this is going to be a good option for people with peripheral vascular disease. How is it that EDTA is increasing blood flow in these peripheral vascular disease patients? Well, there's Posey's law, which shows that if you double the radius, you tremendously increase the volume flow rate, which we saw on the increased flow rate on the post-treated patients. So EDTA is doing something probably along the nitric oxide lines to increase blood flow that way. It may have some long-term effects too that we saw in the very first TAC trial, where the curves didn't even change for a year, but the outcomes got better as time went on. So there's at least two things going on, one with the metals and probably another with nitric oxide related things. So the summary of EDTA and PVD shows studies from the 60s through the 90s that showed EDTA was effective for limb salvage, especially with treating PVD and preventing amputations. In the double-blinded random controlled TAC trial that started in 2000, it showed a 58% event risk reduction in post-MI diabetic patients that also had PVD. The next series of TAC studies will include limb salvage studies, so stay tuned.